Hello everyone and welcome to our second Secular Vision podcast edition. I'm Sonia Diaz and here with PI, Principal Investigator Birgitte Regenberg, who is Associate Professor at the Department of Biology at the University of Copenhagen and the coordinator of the Circular Vision European Research Project. Our project with goal is to explore the new opportunities circular DNA creates in early diagnosis and monitoring of disease such as cancer and inflammatory bowel disease, IBD. And about inflammatory bowel disease is our podcast today, a disease that is affecting over 3 million people across Europe. IBD can have an extremely impact on the lives of the people who is suffering from it. And the burden of chronic inflammatory bowel disease is estimated cost the EU more than 4 million euros every year.
Yes, that's correct, Sonia. So in our project, we speculate that to help this burden, we can use circular DNA found in the blood in tissue, such as tumor tissue and intestinal tissue from IBD and urine as biomarker for cancer and for inflammatory bowel disease, which will allow for early diagnosis of the diseases, especially cancer, and also sensitive monitoring of the disease before any symptoms occur. And this is especially important for inflammatory disease because here we really lack early markers or markers that we can use to monitor the disease and how treatment of inflammatory disease progresses. So we're also looking for genetic factors in inflammatory disease that can connect the disease to the genes we have and maybe help us to treat the patients. So we especially use circular DNA that derives from the chromosomes to understand the diseases. So for this, we started working with our Italian partner, Professor Antonio Gasbarrini and gastroenterologist Franco Scaldaferri. And they specifically contribute to this project with blood samples and tissue samples from intestine in the Circular Vision project. Professor Antonio Gasbarrini is full professor of gastroenterology at the Catholic University of Rome, and he's also chairman of the gastroenterology division at the Gemelli Hospital. And Franco Scaldaferri is a gastroenterologist at the gastro unit of Fondazione Policlinico Universitario Gemelli. And with this expertise and responsibility, he includes our patients and investigate and take samples not only for purification of the DNA, but also for endoscopy and other research activity we have with these patients. Sonia and I met them in Rome at our last EU meeting.
Yes, that's correct. And I have the opportunity to interview Professor Antonio Gasbarrini and Franco Scaldaferri at the Gemelli Hospital in Rome. And in our conversation, they talk about the responsibilities in the Circular Vision project, the expertise in the inflammatory bowel disease, and if they were already some promising outcomes to share here with our audience. Professor Antonio Gasbarrini explaining that inflammatory bowel disease are a group of disorders which includes ulcerative colitis and Crohn disease, involving chronic inflammation of the gut, and that the exact etiology of inflammatory bowel disease is not well known.
In particular, my unit is involved as a clinical unit. We have an incredibly high casuistic of inflammatory disorder of the GI, of the gastrointestinal tract. In particular, we are dedicated in a peculiar subset of the project that is the role of circular DNA, and if circular DNA is going around in patients with IBD, that means inflammatory bowel disease, that are ulcerative colitis or Crohn disease. In particular, these diseases are a kind of autoimmune disorder where our immune system of the gut attack the ecosystem of the gut, in particular attack the gut microbiota. Not that really of us know why the immune system at one point started to attack the microbiota. In some way, we lose the tolerance with our gut microbiota. In the past, many hypotheses have been taken in consideration. Some of them are genetic, others are epigenetic. We know for sure that the stress enters in the disease. But at the moment, if we have to be honest, we don't know why ulcerative colitis and Crohn disease appear. And really what we know, we have to be good in a quick diagnosis, and we have a lot of very, very powerful biological immunosuppressive drugs. The issue, however, we have many questions on early biomarker of disease progression, and biomarker of efficacy of the different therapy that we have. And I really think that circular DNA can give us a lot of new information, not only circular DNA in the bloodstream, but also circular DNA in the tissue. In particular, my center is dedicated to the enrollment of healthy control in patients with ulcerative colitis and Crohn disease at various stages of the disease. I mean that at the starting of the natural history and after different kind of powerful biological immunosuppressive agent. And our aim would be, together with a great group of friends of researchers, to understand if circular DNA can help us as an early biomarker of disease, both in the biopsies, this means in the gut, then in the bloodstream.
And then Franco Scaldaferri explained what are the common symptoms of the disease and how living with a chronic illness is very hard, and how the physical difficulties can also lead to emotional difficulties.
Yeah, the best thing that I was excited when Brigitta for the first time asked us to be part of this European network. For the first time we had the opportunity to understand whether the circular DNA, which is a novel, perhaps physiological component of our immune and non-immune system, whether this circular DNA can have a role also in IBD. And as I told you before, IBD are multifactorial, so we don't have a one cause. We need to study interaction of environment, genetic and non-genetic factors, and circular DNA can be a potential novel marker for pathogenesis, or why not, to differentiate patients with different histories or patients which can eventually respond to different therapeutic strategies. This is very intriguing from the scientific perspective, but that are associated with a lot of morbidity for patients. Patients can suffer a lot for several symptoms that are common in gastroenterology, abdominal pain, diarrhea, but also constipation, also other symptoms like malabsorption, and very important, last but not the least, the involvement of the inside, leaving the disease with a chronic illness, being young, like the majority of our patients, is very heavy for the spirit, not just for from the body, okay, of a person.
And then I asked Franco Scaldaferri if there were already some promising results to share in this podcast edition.
To our actual knowledge right now, we know that circular DNA itself as a novel marker has not been studied yet in inflammatory bowel disease. There are, data that are not exactly focusing on the circles that we were able to find already, and we do have data already in the first year that we are working on it. We are circles from the blood of patients, but we are much more interested in circles from the biopsies of our patients. So perhaps we will be able to discover novel pathways, starting from circular DNA. This is our hope, of course.
And then I asked Professor Antonio Gasbarrini if there are already some important outcomes to share here with our audience, and how our project, the Circular Vision project, is the first in the world to investigate circular DNA as an early marker to IBD.
I am really happy to participate to this project, because at the moment the circular DNA technique and methodology is really a novelty in the inflammatory bowel disease world. Probably we will be, if we are lucky and if we have good result, one among the first center in the world in order to demonstrate that circular DNA can help us as a marker, early marker of disease, a marker of disease progression, a marker of response to therapy, or a marker, because you know that inflammatory bowel disease are somehow risk factor for colon and gastrointestinal cancer. Probably we can also study in particular the role that circular DNA genes can have in progression from severe IBD to colon and GI cancer. So really is a disease that is fastly growing in Europe and everywhere in the world, I have to tell you. And but however, we still don't know why the disease is coming and how can we really stop it without using powerful immunosuppressive drug.
Finally, I ask both Professor Antonio Gasbarrini and Franco Scaldaferri why it's so important to get funding from EU for the diagnosis, screening and monitoring of inflammatory bowel disease.
Absolutely, I agree with you. It's very important to have a sort of European view on this project. I think that alone we would have never done this by ourselves. Why? Because yeah, we do have the expertise. We're one of the biggest center in Italy, perhaps in Europe, of IBD, and but we didn't have the expertise for circular DNA. We didn't have the contact with you know, the industry that is developing a new modality of looking at this specific marker, and we didn't have also contacts, we didn't know actually, contacts of other groups that are giving new insight in how those circuits have a physiological or pathological role. So I think that this unknown network since the beginning, because we didn't know each other only by papers, only by names perhaps, and also by, how can I say, good, you know, we all are good researchers in the field. However, once you start knowing each other, you start thinking, you start putting a project that you alone you would have never done, and actually we are really realizing it. So I'm very happy for this. You know, also the facility from Spain, from Denmark, from Germany. So very interesting research meeting. You know, forced us. Yeah, I'm happy that in Rome there was the very first on-person meeting with new results to share.
This European project, this Horizon 2020 European project, is a great opportunity not only to do great discovery, but also to know and start to work with great friends that work in basic research. One of the main issues in all the big clinical grant and basic grant is that quite often the clinician and the basic scientists do not work together. And really, if we want really to understand the process, we have to put together this community. In this European project, I was really lucky because we have a fantastic friend from the Northern Europe, from France, from Spain, from Switzerland, from other countries, and all together I think we are doing a great group of friends and researchers and clinicians. We try always, and this is I can say that is the must of my unit. We have always to to put the patient first. I mean, we have to find answer for the patient, and I really think that the design of this project is really in order to understand and to give to our patient new way to understand the reason why they got this disease. And I'm really happy to find a fantastic group of researchers, and really I have to thank the European community to give us this grant, because only putting together researchers from different parts of Europe and with different expertise, we will do a great European community.
Just to finalize, there is something that you want to share that you would like to highlight?
Yeah, one of the reasons that I'm really happy to participate to this project is because I belong to the community of the so-called microbiota freaks. I mean that since 30 years my unit is working on gut microbiota, that for us is one of the more incredible new discovery in medicine. By the way, it's called the microbiota revolution in this moment. And what we really to focus in this project and in the future is the role also of circular DNA for microbial population. We know in particular that the circular DNA is not only released by human cells, but probably also by microbial cells. In particular, in my unit, working with a dirty behavior, that is the gastrointestinal tract, we can give to the community more information on circular DNA produced by bacteria and directly by the epithelial cells.
Thank you very much, Sonia, for your interview with Professor Antonio Gasbarrini and Franco Scaldaferri about the inflammatory bowel disease and how it affects patients out there that have the disease and maybe also their families. And for those of you who want to hear more and read more about our research, you can go to our website, circularvision, in one word, .org, where you will read about our work, or you can subscribe to our newsletter. I'm Professor Birgitte Regenberg with Sonia Diaz at the University of Copenhagen. Stay tuned for our next podcast in 2022 with a guest speaker, Estrid Høgdahl, who is head of the nationwide Danish biobank for cancer samples, in which we have tumor samples and plasma and blood samples from all the different cancers that are being operated in Denmark. And she will talk about why it's so important to have this biobank for research and for understanding and for future treatment and diagnosis of cancers. I hope you will hear our next podcast, and thank you very much for joining us, and have a great day.